These x-rays are from a patient with 7 years of left-sided hip and ankle pain that she thought was coming from SI joint dysfunction. She came in with a limp and she couldn't even go up and down stairs without significant pain. Her active lifestyle was crippled, but it didn't have to be. But let's hear it from her.
So I have been dealing with hip pain on my left side and ankle pain on my left side for last 7-8 years. And during that time, I have tried multiple things like chiropractic treatment, physical therapy, the foam roller, the stretches, the strengthening exercises, massage gun. I mean, I have tried everything to fix this pain, but it's been a constant pain 24/7.
These x-rays were taken by another doctor 9 months prior to the patient coming and seeing me. And they clearly show an anatomical leg length difference, also known as a leg length discrepancy. It was even written in the patient's imaging report, but nothing was done to balance her out, and so she continued in pain. And that's how she ended up in my office. I'm Dr. Brant Pedersen, and in this video, I'm going to share with you what I did to get her back to doing all her activities pain-free in just 4 weeks. We'll actually check back in with her towards the end of this video so you can hear it directly from her. You see, it doesn't take 7 years of treatment to get rid of 7 years of pain, but it does take a skillful approach to finding the underlying cause and then directing the treatment at that root cause. It is my hope and intention that through watching this video, if you are struggling with pain in your body, that you might develop a better understanding of what could be causing your pain, and that you will be better equipped to get the most out of your interactions with your healthcare providers. Over the next few minutes, I'll help you understand what the pain from a leg length difference feels like, how the leg length difference is measured, and I'm going to share with you a test you can do to check that on yourself, what causes leg length discrepancy, at what point is a short leg something that should be addressed, and lastly, what can be done to balance out your legs if they are different lengths. We've got a lot to cover, so let's go. Before we get started on the symptoms someone might feel with a leg length discrepancy, I want to address that I've seen some other videos on YouTube talking about leg length difference indifferently. Like it doesn't matter much, since it's estimated in the medical literature that 70% of people have a difference in the lengths of their legs. It is really important we get this right. So I want to agree and disagree with that viewpoint that it doesn't matter much. First, I agree that many times someone can have a leg length difference and their body learns to compensate for it. And for the most part, they live a normal, pain-free life. They may or may not wonder why at age 67, one of their knees needed to be replaced and not the other. Odd, since they took the same number of steps with both knees. But overall, their body's doing just fine. Also, in a bit, I'm going to talk about the difference between a functional and an anatomical or structural leg length difference. So that'll also shed some light on this. But let's take the corollary, that your body, like a high-performance race car, runs to very tight tolerances. That with a significantly shortened leg, and we'll talk about how much is significant in a moment, that it puts added stress into your ankle, knee, hip, SI joint, and back every time you take a step. Is that a big deal? Well, let's see what the medical literature says. This study is from one of the most prestigious medical journals in the world, the Annals of Internal Medicine. And in 2010, they did a study of 3,000 people. The question they were asking, does leg length inequality greater than 1 centimeter, which is about 6/4 thick, increase your chances of getting knee arthritis? To do this, they took standing full limb x-rays to determine leg length inequality. That's the gold standard. And they also got detailed knee x-rays looking for arthritis. Then 2.5 years later, they took another set of knee x-rays, and what they found was shocking. In the people with a leg length difference greater than 1 centimeter, remember that's 6/4 thick, 50% more of them had developed arthritis in their knees versus those with less than a centimeter difference. That's just in 2.5 years. Imagine having a leg length difference for decades and not getting it corrected, and the long-term damage that that can do to your joints. And in a 2019 literature review, that's a study where they look at all the combined studies on a subject, it showed that hip and knee pathology, that's something like arthritis, is present in an increased number of patients with leg length discrepancy just over 5 millimeters. That's only 3/4 thick. So leg length discrepancy is a small thing that can have big implications for your joint health and helping you feel balanced and pain-free. But how do we determine if someone has a leg length difference? Well, I will say that it's hard to determine if someone has a short leg just by going off symptoms. That is because the symptoms associated with leg length difference are really varied and can impact all sorts of joints throughout the body. Again, from the Annals of Internal Medicine, leg length inequality has been implicated as a cause of several conditions, including low back pain, trochanteric bursitis, osteoarthritis of the hip and knee pain, and running injuries such as Achilles rupture. In my clinical practice, I've seen leg length difference show up as pain in the following regions: foot pain, many times at the heel, ankle pain, knee pain, hip pain, SI joint pain, and back pain. The pain in these areas can be pain in the joints themselves, or can show up as tendinitis or bursitis, or even myofascial or referral type pain. And interestingly, these pains don't always line up on the side of the short leg. It's variable amongst people which side, the short leg or the long leg side, will be the one with the most painful tissues. We think that might have something to do with how people develop different compensatory patterns to deal with the imbalance, but there's no clear link. So here are the methods we use to assess for leg length difference, including one you can try at home. First, in the office, we have a patient take off their shoes and stand with their feet about hips width apart, heels even with their knees locked out. We then put our index finger on their iliac crest, this area right here, and visually assess for a relative height difference. If a difference is noted and it's significant, greater than about a half an inch, then we'll take and shim up the short leg side with a heel lift and then reassess to see how much it takes to get the iliac crest level. Another test we use, and this one is one you can do at home more easily, is having a person lie on their back with their knees up, feet together, and heels even. Then we look from the side and see if the knees are even. If they are not even, like one knee is elevated higher than the other, we suspect a leg length difference. This is a test that you can do at home, but it can be helpful if you have someone that can sight your knees in profile, ideally from one side and then from the other when you're lying down. When you do this, do you notice a difference in your knee height? One other method involves a person lying on their back and using a tape measure. With the person lying on their back and the legs out straight, we run the tape from what's called the ASIS to their medial malleolus, these spots right here. Then we compare the dimensions from side to side. Again, this is possible to do at home, but knowledge of anatomical landmarks and surface anatomy are key to getting accurate measures. But the gold standard test is x-rays from the ankle bone up to the hip bone and measuring the bones directly on those films. Then we compare the measurements from side to side. The question on whether to take these films with the patient standing, knees locked out, or lying on their back is something that's debated and comes down to doctor preference. My preference, especially if the patient is in some pain, is to have them taken with a patient lying on their back because it can provide a more accurate measurement of the bone's length without the influence of muscle and joint factors. That being said, as long as the patient in standing x-rays is barefoot, feet facing symmetrically, knees locked out, and they're flat against the x-ray film canister called the bucky, then standing x-rays should work just fine. So what causes anatomical leg length difference? Actually, there's only a few different causes. Let's go over those now. The first cause happens during bone development, before someone reaches what is called skeletal maturity. That's somewhere prior to age 17 in females and age 18 in males. Bones can grow at different rates, although this is rare. But if there is a trauma or a fracture through a bone's growth plate prior to skeletal maturity, that can cause your long bones, like the femur or the tibia in your legs, to finalize their growth at different lengths. The second cause is trauma. Example, this is a male patient that came in to see me. He was in his 60s and he had unresolving low back pain. The back pain had been there for about 3 years. He'd seen his MD, done physical therapy, been to a chiropractor. Nothing was working. Glad he ended up in my office because his pain continued to get worse and worse. During my exam, I noticed that he had a leg length inequality, and after working on him during that first visit, I noticed that his leg length inequality hadn't balanced out completely. That gave me pause. It gave me pause because of something we'll talk about shortly, which is the difference between an anatomical or structural leg length difference and a functional leg length difference. Because his leg lengths hadn't balanced out after the treatment, I asked him if he'd ever had any major trauma to his legs. Kind of a random question, right? He thought for a minute and then said, yeah, there was this one time About 5 years ago when I was golfing in Hawaii, I got out of the golf cart, I walked down the slope, take a shot, and I was eyeing the hole when the golf cart ran into my lower leg. He'd forgotten to engage the parking brake when he got out of the cart. His left lower leg bones, the tibia and the fibula, were shattered into many pieces. His surgeon did a great job making a functioning lower leg out of bone fragments. But after the surgery, his legs were not the same length. The problem was that for years following this injury and the surgery, out of all the doctors he'd seen for his back pain, none had clued him into the importance of balancing leg length and how that could cause his lower back pain. I recommended a heel lift to him, and we measured it to make sure that we got him the proper size. I told him to wear it in all his shoes, and in a week he came back into my office for a follow-up, and he was overjoyed. 90% of his back pain resolved, and he was walking and bending without pain. He was ready to get back out to golfing. So the second cause of leg length difference can be trauma so significant that it or the treatment for the trauma ends up in a leg length difference. And the last cause that I see occasionally in practice is a leg length inequality after someone has had a total knee or a total hip replacement. These surgeries are amazing and something our ancestors could have only dreamed of. But orthopedics is sterile, advanced carpentry on the human body. While all care is taken to get the legs perfectly equal at the end of surgery, sometimes they're not totally balanced out, and that can lead to other problems. But there are simple solutions to find that balance externally versus feeling like your body has to be in pain forever. So what if we find a leg length difference? Then what? Before I answer that, I want to make one clarification that can have big implications before we get into how to address leg length inequality. The clarification is the difference between an anatomical or structural leg length difference, those are the same thing, and a functional leg length difference. This is a big deal because you may have been told that you have one leg that's shorter than the other. It might have been by a chiropractor. And that can lead you to wondering if you're forever imbalanced. Well, chiropractors frequently do something called a leg check when a patient's lying face down. We look at your relative leg lengths when your legs are down and when we bend them up at 90 degrees to see if there's a change in length observed. It can tell us a lot of things about what's going on in your pelvis, like SI joint issues. But, and this is key, most of the time after you get adjusted by the chiropractor, your leg lengths should have balanced out. What? That's because when you get your pelvis moving properly, the muscles that were guarding that joint on one side, like your quadratus lumborum, for example, can calm down and are no longer pulling up on the pelvis and creating a short leg on that side. So the functional cause of the leg length difference has been addressed. After I adjust a patient, like that patient that got hit by the golf cart, I always go back down and check that their legs have balanced out. But if they've not balanced out, then I'm suspicious. And I'm looking for, is there possibly an anatomical leg length difference? Because a difference in the length of your bones cannot be taken care of by a chiropractic adjustment. Not even 1,000 chiropractic adjustments. So if your chiropractor or other doctor has told you that you have a short leg, you should follow up with the question, is it a structural or a functional leg length difference? The reason to ask is that the treatment of those two types of leg length inequality are vastly different. They do not work interchangeably. And one last point on this. If you have a functional leg length difference and you go to your chiropractor and you get it adjusted and you feel better and then it comes right back, then I believe the chiropractor should be helping you understand why it keeps coming back and helping you to address that underlying cause. I find in my practice that determining the underlying cause is the hard work. The adjusting of the joint is the easy part. Ideas on what can be causing a functional leg length difference to reoccur are wide-ranging and can be things like muscle weakness in your gluteus medius, core muscle weakness, piriformis spasm or weakness, and really any asymmetrical muscle weakness. Also scar tissue and adhesions from past physical trauma and or surgery, lower extremity issues like asymmetrical falling arches, ankle, knee, or hip issues, and anatomical leg length difference, which you're becoming well-versed in by watching this video. And it can also be caused by ergonomic or postural considerations. Each of those has a solution, but determining the underlying issue is key. If you haven't been able to work through this with your doctor yet, don't give up. Search around for reviews of doctors in your area. And if you're in California, look me up, Dr. Brant Pedersen. I'd be more than honored to help you out. Now back to the solutions for a structural leg length difference. The good news is, just like we discussed, finding and understanding the problem is much or most of the battle in getting relief from an anatomical short leg. The treatment is actually quite simple and accessible, and we'll go through that with you now. But before I give you the details of the treatment, I want to say that correcting a leg length difference with a heel lift or shoe modification is a personal decision. It's also a medical one. And I strongly recommend that you work with a doctor skilled in evaluation and treatment of anatomical leg length difference to help you determine the best course of care in your individual situation. Okay, let's get to the details. If the leg length inequality is less than 1/2 inch, about 12 millimeters, then a heel lift can be added to the shoe of the short leg to help even out the legs. There are a few key points with this. If the leg length difference has been there for a long time, then it's usually recommended that the heel lift be added slowly, like 3 millimeters a week, until the necessary thickness is achieved. This helps the body to learn to accept the gradual changes in leg length without causing compensations, which can cause their own issues. A heel lift like this allows for 1 millimeter increment increases up to 12 millimeters, so you can get things balanced out perfectly. If, however, your leg length difference started recently, like after a surgery, then it's usually recommended to start with the full height of the balancing lift without slowly working your way up to the full dimension. This helps to minimize any adaptive changes that can begin with sudden introduction of a leg length difference. A few things on choosing a heel lift. I don't have any relationships with the manufacturers on heel lifts, but I do have some of my favorites. I can tell you I've used a lot of different types, and what I've come to and what's really important feature of any heel lift is to make sure that the heel lift material itself does not break down or become thinner over time with extended wear. You may feel like, hey, if I'm going to put it in my shoe, I want it to be comfortable. But the trick is that you're going to put the heel lift underneath the insert of your shoe. So just like underneath your insert is not soft in your shoe, the heel lift itself doesn't need to be soft. But what's important is that over time, if the material compresses, then you don't end up with the same dimension. These heel lifts by Clearly Adjustable Heel Lift, and I'll throw a link down below where I get them, is the best that I've tried. It's made of this clear vinyl material that's, will conform to your foot and your heel, but it doesn't compress over time. And it's got 1 millimeter increments, so you can get the perfect fit. A lot of other ones will have like a 3 millimeter increment difference in between layers. When a heel lift is needed, it's only required in one of your shoes on the short leg side. I don't have a short leg, but I keep pointing towards my left leg. And the heel lift should be added to all of your shoes that are regularly worn, including house slippers and sandals. What about if you need more than a 12 millimeter or 1/2 inch lift to balance out your leg length difference? Well, when that occurs, there's two options. The first is if there's room to add a full length insert under the footbed of the shoe, just on the one side, on the short leg side. But the buildup can really decrease the toe box room in a lot of shoes, and we don't want to get the heel up too high where we lose stability of the heel box support. That could lead to rolling of an ankle or a fall, and that's no good. The other option is to work with a cobbler, someone who repairs and customizes shoes. They can add a full-length lift to the sole of one of your shoes after it's determined what exact dimension is needed. This would then need to be done to all of your shoes that you wear regularly, but what I have my patients do is just start with one pair of shoes and see how it works out prior to modifying multiple pairs of footwear. Now let's check in with the patient we heard from at the beginning of the video about how she responded to getting her legs balanced out using a heel lift. Really watch how her face is aglow and the energy difference in her voice versus the first video.
So 4 weeks ago, I was in such a bad chronic pain. I could not walk even 100 steps, and I had a very active lifestyle. Before that, I was running 10 to 12 miles every Saturday, doing my strength exercises. But 4 weeks back, I couldn't do any of that. I was limping while walking. I couldn't climb the stairs in my house. I was just pretty much immobile and desperate to get help. But just 4 weeks after my treatment at Positive Motion Chiropractic, now I feel I'm 95% healed. I'm back to my running slowly. This entire week, I did my strength exercises 3 times in last week. I'm back to my squats and lunges and deadlifts, so I'm very happy.
It took a handful of visits to get everything balanced out with her, even after she started wearing the heel lift because of the compensations that her body had made over the years. There was some cleanup to do. And also, we did slowly increase the dimension of her heel lift over a few weeks to allow her body to accept the structural changes that we were introducing. There's one other foot problem that I many times find with my SI joint pain patients, but that can also show up as knee, ankle, hip, or low back pain. It's a real troublemaker. In this video to watch next, I go through how I assess for that condition, how it can cause all sorts of varied pains, and what can be done about it. As always, thanks for watching. What are your goals going forward for your health?
I want to run my half marathon in October, back to my rock and roll San Jose. So that's my goal for this year for sure.